It's called the Marine Corps Marathon, DC.
DC?
Washington, D.C.?
Yeah.
You were there just for that? Or?
Yeah, my son was running in it, so I ran with him. A lot of fun.
Everybody just came up. Butter.
Oh, the whole paper thing.
Yeah, must put the butter in there. Forgot to blow the paper out.
Occupational animal allergy.
Getting rain down on your golf.
Yeah.
Playing the rain.
Yeah. It's really raining. Got real good wind here now.
Nick made it to the memorial service too. Well, like I said, plenty of bodies there. So you probably noticed. Stan Zeitz and
Stan there?
Yeah, Stan spoke briefly, and so did Jim Stroh and his wife. And the 3 kids. No, they didn't have a opportunity to anything else. They didn't do that.
What's in my purse?
What actually took this like?
It's in my purse.
Some progressive neurological problem.
Oh, really?
You don't know exactly what it was.
Huh.
I think it came first myalgias.
I went to school there.
That's my guess.
That's the word for the day.
Yeah,
She looks online.
it was that bad.
Okay.
Yeah.
We're gonna wear what's on one.
People take off at like this time, they're like everything's like, that's ridiculous. Yeah, and then I'm like,
Oh yeah. So you start off in the pen, and you go up. You go up to cross over the bridge to Georgetown.
figure that part out.
Along the river at that point. Go out towards some of the other monuments. Back all around the mall.
Not specifically, but I'll look at Breckenridge, one church on the wall.
Yeah.
My brother-in-law has a place.
How are you? Good.
It's a wedding. Bachelor party this weekend?
Dallas.
Yeah. Kevin forgot about it. He forgot to cancel his patients, but he'll be there. Yeah.
I'm like ready.
Why Dallas? Oh, okay.
from the board guys, maybe more of an excuse to go.
Yeah, the word of the day, fan hurdle.
Yeah, we should win. Allergy.
Yeah, without right now. Awesome.
Put in the word of the day. Still gives you the credit. That's okay, credit.
Okay, so to our outside audience, hopefully you've got a good transmission today. We'll send out
I'm doing it right now.
okay, we'll send, we didn't send it out yesterday. Trixie, the secretary, had to go home early yesterday. But for those of you who want to print and retain it, you can get a PowerPoint. It'll come later, but hopefully everybody will have the slides to follow along today. So Peter Rabinowitz from our Department of Environmental Health and Occupational Medicine is going to give us a talk today on a very practical topic that we deal with every day, animal allergies. As occupational, we'll probably touch on home pets as well.
A little bit.
A little bit. All right.
A little bit on the workplace, yeah.
All right.
Fantastic. And the volume, the audio is okay for me to just talk like this?
I think you just speak loudly.
Okay.
Yeah, we usually just have trouble with women's voices.
All right. I'll try to speak clearly. So good morning, and thanks for the chance to come and talk with you all. As you just heard, I'm a physician who specializes in occupational medicine, and so we see workers and people who are concerned about something in their work or their environment that's making them sick for all sorts of reasons. And I think the occupational medicine physicians share a lot in common with allergy specialists, because we're really trying to figure out what in the environment could be causing a particular health problem, and what do you do about it? And sometimes the cure is a medication, and sometimes it's really trying to modify the environment in some way. And the kind of environments that I've become most interested in are the ones where there's a lot of animals involved, where I think a lot of allergy issues are very present. And I'm going to, I haven't really had the chance to talk directly with a group of allergists about some of these issues, so I'd be very interested in any questions from the group about these kind of cases, and whether this is something that is absolutely you see every day, or that there's some questions that arise about these kind of cases. So what I'm going to try to do is talk about how in the workplace setting, animal allergy tends to manifest itself, and we will talk about non-occupational exposure a little bit, but we're going to focus on the workplace, and we're going to focus on a couple of workplaces. Since this is Seattle and it's a urban environment, and we're down at South Lake Union where there's a lot of research going on, I think it's appropriate to talk about this issue of laboratory animal allergy. There's a lot of people in Seattle working with a lot of animals. At the University of Washington, there are more animals than students, as you probably know. Most of them are small little white furry things with 4 legs. We're also going to talk about farming and the animal agriculture, which is really becoming a larger and larger organized industry, and it's got a lot of issues with exposures and the allergic exposures to people. But there's also this question that you've heard about living on a farm and whether that's actually good for you, and whether exposure to allergens and antigens has a beneficial effect on the immune system and not always just a negative effect. And again, I'd be interested to know how often you see some of these other things, but I'll mention some other kind of hypersensitivity reactions related to animal exposures, including hypersensitivity pneumonitis, and some other exposures in these animal workplaces, including endotoxin exposure. And finally, I just want you to have some familiarity with the idea that when you work and when you deal with either people in a workplace who are working closely with animals, or the fact that we share our living spaces more and more with animals. My understanding is that there are more dogs than kids in Seattle right now. And I was flying on a plane last night, and someone had a dog in their lap. And I've been on planes where people will have a cat right next to me. So we're sharing a lot of our personal space with animals. And the One Health concept involves really understanding that we're dealing with this whole set of living beings that have a lot of, they can certainly make us allergic, but they also get allergic themselves. And there sometimes can be some value at sharing knowledge about some of these contact issues between the professionals that are dealing with the animal health, which is veterinarians, and that when sometimes the physicians and veterinarians and we're both dealing with things in the environment that may be affecting both types of species. So I'm going to start just sort of the brief overview about occupational animal allergy. So what do we think about as groups at risk? So when someone comes to your office and they are referred for allergic complaints, what sort of occupational history do you tend to take, and what parts of that history may indicate that this person has some unusual exposures that could require some extra consideration of what kind of allergy problems they have or what you might do about their environment. So again, I think anybody who tells you that they work in an animal lab with mice or rats, or even if they work close to an animal laboratory, because of the air circulation issues and the levels of allergen exposure, even people working in, say, administrative areas near an animal lab may be at risk for exposure to those kind of allergens. Farm workers, it's not that common in Seattle that you see someone who works all their time on a farm, but there's a lot of part-time farming going on in Seattle. Urban chicken farming is a big booming business. People want to have, I think you're allowed to have up to 8 chickens in Seattle and 1 or 2 goats, and a lot of people take advantage of that. And they also may spend some of their time working on some sort of sustainable farm in the urban area. But they're in Washington State itself, there's certain agricultural industries like dairy that are actually very big, and there's a lot of people in Washington State who spend time working on farms. The veterinary workers, as I said, I think that both occupational and allergy specialists share something in common with veterinarians because we're dealing with problems related to environments that can affect the health of our patients. And if you're a veterinarian, you're also working in the workplace with a lot of different types of animals and a lot of exposures, and allergy is a major problem for veterinary workers. There's also this whole class of animal care workers who are involved in the numerous industries related to all these pets that we now have, including pet grooming parlors and pet stores and things like that. And those people are exposed to often very diverse types of allergens and at different levels. This is the Northwest. There's a lot of fisheries going on. There's a lot of shellfish, crab types of industries if you get up into Alaska. And if you think about knowing some of your patients with shellfish allergies, think about people who have to work with crab meat all day long in a large factory where there's constantly aerosols of all the particles from the shellfish and things like that. So that animal allergies in shellfish workers and fisheries, cannery workers is well described as well. And we've got things like the aquarium and the Seattle Zoo where there's a lot of different types of exotic animals, a lot of bedding, and like a little small farm in some ways, so that kind of exposure history should set off some questions about what's going on and what are you going to possibly do about it.
Are you going to come back to the fisheries issue? Because
no, I'm not. I wasn't planning to very much, so we could do it now.
yeah, well, that's why I bring it up. So interestingly, that's shifted away. Drew published a paper on this. We used to see crab workers' occupational asthma.
Okay.
And that seems to have disappeared. And what's happened more recently is pollock has become a big commercial fish. They sell a lot of it. They fish it up in Alaska. They sell a lot of it in Japan. They make artificial crab out of it.
Yeah.
And it's taken over as the main occupational thing. I would say once a month in our private practice, one of the seafood companies in the Ballard area sends a patient, and what was the other fish, Drew? Yellowfin sole?
So they're skin test positive for
They're inhalation
or
provocation positive.
inhalation provocation. So
Yeah.
where are you doing inhalation provocation tests in?
At our practice.
In your practice,
Yeah,
really?
right. And it used to be just one major company, Trident, I think is the largest company here. But now there are half a dozen seafood companies that all compete, all have their home offices along the Ship Canal in Ballard, and it's actually a big regional problem.
And for your inhalation provocation, you've created an extract of pollock and an extract of yellow
Yes.
sole and things like that.
Yes.
You use a Basomatic to... I think you do, don't
Yeah,
you?
don't you do the TV commercials for them, right?
Yeah.
All right, so, and I don't know why crab workers' asthma has disappeared, and the industry's changed their practices some, but it was the first of the major reported things, and we don't see it much anymore. It's been replaced with these fin fish reactions.
Well, most of those are skin test negative, though, so it's not.
And they can eat it. It's
they
not,
can eat it.
they don't have
so
food
it's something else, aerosolized.
It's aerosolized. It's airborne occupational asthma.
But it's not IgE mediated? I mean,
Well, it may be IgE, but it is not the
It is
fish.
IgE mediated. But
Interesting.
Yeah.
they do have positive skin tests, but that's an interesting question, why they can eat it. They do have positive skin tests to extracts that we prepare. Usually the fishing companies give us the catch. They'll give us a representative fish out of the catch.
They will. Okay.
And we make an extract out of it.
And you wonder if there's another substance in there that's provoking. And that's-
We don't know what the antidote is.
As I'll show you, there's some interesting questions about that. Not everything is quite as it seems. So this is a typical case that would be referred to you from possibly an occupational medicine clinic where they're seeing a worker who says that they are complaining of typical allergic symptoms: sneezing, rhinitis, nasal discharge, conjunctivitis, tearing, itching, dermatitis. And this is a person with mild atopy, smokes half a pack a day, worked at his current job 2 years, and he's working with mice in a small pharmaceutical company, and about a year after starting working with the mice, he noticed that his symptoms started and really had not had symptoms like that, and his job is changing bedding and cleaning the cages. Again, there's thousands of people working at the University of Washington alone. We have 4,000 people working in and around animal laboratories, so this is not an uncommon exposure. And on exam, he has just mild conjunctivitis and occasional wheeze. So what are the things that could be going on in the laboratory animal setting? There are exposures from the animals themselves, such as the animal urine, the dander, and the saliva. And then realize that these are complex environments wherever the animals are involved, because the animals have bedding, they have feed, which could be contaminated with mold, it could be contaminated with dust mites, insects get in other ways. And so it's not always clear whether they're actually developing an allergy to an animal or to the environment around the animal. So in terms of how common this problem is just in laboratory animal allergy, and I'd say for occupational allergy, laboratory animal allergy is the best studied type of occupational animal allergy. And it's been a little hard to get a good handle on how common this is, because many times these are cross-sectional studies that do not always include the people who got sick for a while and then dropped out, leaving behind the healthy workers, so that you sometimes underestimate how common these problems actually are. But in a longitudinal study, it looks like for every 100 workers, about 2 per year are developing a new animal allergy from exposure to these sort of research or laboratory animal situations. And that when you actually look at a group of workers, it can vary between workplaces, but in various studies, up to 30% of the people working in some workforces are reporting some degree of allergy symptoms. So it's really, really common, and it's a huge problem in these animal laboratories where, again, you're trying to balance a number of things. You're trying to balance the research needs of the study, you're trying to balance the health needs of the animals, and then you've got these workers who are developing some health issues, and you have to figure out how that's going to factor into your entire operation. There are some personal risk factors for laboratory animal allergy in the literature. It looks like smokers are more at risk than non-smokers, and a history of atopy and a history of allergy to any other furred animals seem to be a predisposing factor, so that when you see these people in their pre-placement screening, you have to decide if you're going to do any further testing on that. And that it's not just allergies, as you know, it's not just the rhinitis and the conjunctivitis, but there's the real chance, just like the crab workers you're talking about, that you'll develop a more serious complication of asthma. And the NIOSH, the National Institute for Occupational Safety and Health, which does research in occupational issues around the country, estimates that 10% of laboratory animal workers will develop asthma. So if you take a group of 4,000 workers like we have at the University of Washington, you think about 10% of them developing asthma. That's a lot of cases of occupational asthma, and obviously varies somewhat depending on exposure, but it's a significant risk. This is just from a educational training program by the State Workers' Comp Office, the Labor and Industry Office, talking about the types of occupational asthma to think about in animal workers and what are the causative agents, so that you've got the animal urine, the proteins, and other allergens, and the people working with those animals in laboratories and research sites. You've got grain mites, you've got the prawns and the crabs and the seafood processors, and then egg producers. Eggs are not a huge industry in the state, but we do have some big egg farms, and egg protein can be an issue as well for asthma. So there's some questions about the relationship between the dose of the allergen and what it does to the person, and it's not like everybody follows a very nice dose-response curve where the more allergen you get, the more people develop symptoms. In fact, in some studies of laboratory animal workers, it seems that the higher exposed people are developing less allergy. And there's a number of paradoxes that you'll see through this whole literature of animal allergy, where there's some theory that, and you may know more detail on this, but there's some theory that a high dose of whatever allergen they're faced with in the workplace and in the laboratory animal setting, that a higher dose can induce production of IgG4, which may be protective against the development of allergic symptoms. And there's also some obvious genetic susceptibility with toll receptors and things like that that can really affect which people develop laboratory animal allergy or not. So it's one of those things where we see people at fairly low exposures, again, working in desk jobs near a laboratory animal lab, an animal lab with enough contact with an administrative area where people could be getting sick at low doses, and then sometimes in the very high dose areas, people are having lower rates of allergy. And another thing to think about is that it makes you wonder about some of these crab asthma patients who are skin test negative. Is there anything else in the mix, in the aerosols and in the exposures for these people in an animal situation that could be bad for your lungs, could be bad for other things that could look like allergy but isn't quite allergy? And one of the things that happens in a laboratory animal setting and in other animal contact settings as well is that you get exposures to endotoxin. And endotoxin is generally the outer lining of gram-negative organisms. It's a lipopolysaccharide type molecules that are able to cause inflammatory responses when they hit our airways, and they really can cause airway inflammation and irritation and can cause reactive airway disease at high enough levels. And so for that reason, sometimes what is, I think, causing a positive bronchial provocation test could be a inflammatory instigator like endotoxin, and not always an allergen. And remember that people working in a lot of these environments also work with very irritating chemicals, cleaning agents, other chemicals sometimes related to the research, and those can cause mucous membrane irritation and similar symptoms as well. So not everything may be IgE allergy. This is just a little more about endotoxin. It's ends up in many of these sort of organic dusts, and whenever you have a lot of animals around, you have a lot of animal feces, you have dried feces, you have dried skin, hair, all the things that you deal with when you look at dust samples and looking for potential allergens. But these are basically the lipopolysaccharide that can then bind to toll-like receptors, release cytokines, and cause inflammatory response without an IgE mechanism. Yeah?
The question on the asthma component of this, I've particularly been concerned with this fish workers' asthma that I've been talking about. Essentially, what is the risk of chronic lung disease developing if you allow people to stay in the workplace? And the model that I'm worried about is we used to have cedar workers' asthma in the Northwest.
Yep.
when we used to have big stands of cedar trees.
Yeah.
And again, I think mostly because we've cut them down, we don't see many people in that
Cedars.
industry. But I remember the work out of British Columbia, where if you let people continue to work in that industry, they would go on to get chronic irreversible lung disease.
Yes.
It was not just symptomatic asthma. And you basically had to remove people from that industry to prevent that. So I'm just, are there parallels in this situation? Maybe you'll get to that when you talk about prevention.
I think as we're talking about now, I think the idea is that early recognition and reduction of exposure could potentially improve the natural history of the disease, and persistent exposure can really run into some problems. So taking cedar as an example, I believe that cedar has the chance to both be an asthmagen, but it also has potential to cause hypersensitive pneumonitis. And that we'll talk about a little more, but that again can cause chronic respiratory restrictive lung disease and definitely interstitial lung disease, which is not necessarily reversible, and that's a really good reason to avoid exposure. But even the asthma, if it is caused by an IgE mediated process of a large molecular weight allergen, I think the more the exposure continues and the more it worsens, the more chance you have of really having chronic asthma that will respond to other things as well later on. I think if it's something like endotoxin, which is causing more of an inflammatory irritant like asthma, my experience just in occupational medicine is that if that type of process continues, the body starts developing a chronic inflammatory response to it, which can lead to some situations that look just like extrinsic asthma, and really sets up a chronic pattern that even after a while, if you stop the insult, it'll continue to have reactive airway disease. So I think there's a lot of reason for early recognition and trying to either remove from exposure or reduce exposure or do something like that. So in terms of prevention, I really again think that in allergy you deal with the environment in ways that many other parts of the medical community does not, with the exception of sort of occupational medicine, where we figure if we can actually make the environment better, it would reduce the need for medications. And do you talk about this in the allergy world, what we call the hierarchy of controls? It's really coming from the industrial hygiene folks who really feel that the best thing to do is to actually control a hazard at its source and actually get rid of it with some sort of either just not using that substance anymore. In the case of an animal, having the animal go somewhere else. If that's not possible, substituting for something else. So if you're thinking about someone in a laboratory animal situation, could you, instead of working with mice, work with guinea pigs or some other type of animal and see if that makes it any better. Engineering controls are really next, which in allergy world is things like HEPA filters and ways to clean the ducts of your house and do all the things to kind of improve the air quality that people are being exposed to. Administrative controls in the workplace means only allowing people to be exposed for a certain amount of time. If it's a highly hazardous situation. And the very last resort is what we're often trained to think of as the first thing, which is put on a mask, put on gloves, put on some sort of personal protective equipment. And so that if you think about all the things we do in hospitals to prevent infections, we often go first to the masks and the gloves, which, as you know, are expensive and clumsy and don't work as well if we don't use them well. And if we could actually eliminate the hazards at the source, it would be better. But does this paradigm get talked about in allergy at all, or it's just not? It's done, but it's just goes by a different name.
Certainly not in a formal way like that do we think about it. We're usually seeing people with home animal exposure, and obviously you talk to them about reduction of exposure, which they usually ignore. We don't do it clearly, I don't think, as formally and intellectually as this. But
Yeah.
others may have.
So this is
opinions.
where, like, the University of Washington has a whole training program to train people to go out into certainly workplaces and try to eliminate exposures like this. And we're not quite as organized in the home environment, but the idea is that maybe if we did a better job at sort of systemic fixes, we wouldn't have to give quite as much. And I think all of you have seen people who've been on medications for long periods of time for something that if they could just get rid of the allergen, they wouldn't have to take as much medication.
Yeah, we tell people to eliminate their pets, and they never do.
Exactly. There are limits to it.
Yeah.
The thing we see at the U, we see a lot of PPE gets our focus because it's a grad student who's devoted years for getting their PhD in immunology, and
Yeah.
there's no one else that can do the lab.
They can do the thing, and they're developing an allergy, and they just want to get them through it. For
Their
2 more
their
years.
whole career is dedicated to doing the surgeries and everything else,
Yeah.
the blood collections from the mice. There's no one else. They're not a senior investigator. They can't hire a technician to
Right.
do that, and they're stuck. So are there some major improvements in the PPEs that would bridge them
Well,
over?
I think N95 use is being pushed a lot more. Again, I think if it's a, I think there's some role that if you're seeing the person to try to get, see if the employer is willing to do anything more systemic about the types of ventilation, about the types of setup of the laboratory to reduce the exposure at the same time. I think that there have been some fixes to really improve sort of local area ventilation around the cages that it's at least worth some conversation with someone related to the workplace, because it is all, it's a work-related problem that would come under workers' comp, and the employer has a lot of incentives to actually do something, because if it's happening to one person, it's going to happen to more people too. And it's not good for their careers. It's not good for the laboratory to be having these kind of people develop this. But it is a really, it's if someone's career is built on what they can do with rodents, it really becomes these are really difficult decisions because it's career determining what they're going to do. So I think that there's no, you can go to a pretty extreme level with PPE and get supplied air, Tyvek suits and respirators and things like that. And some people have had to resort to that in some situations. It's just, you want to, before you get to that, you want to do something else that sometimes can be more systemic and simpler and affect other people as well and be less costly on a daily basis after that. So, but I think it's really, if someone wants to continue working, it's really time to, I think, call out all the troops of seeing what you can do to actually fix the environment a bit instead of just putting people in Tyvek suits. But it is something that happens, and some people have to leave their job or work with a different type of species, and it can be really tough.
How commonly have you seen multiple species like allergies? Like they started with mice and they got allergic, and they switched to rats. They got rats and then hamsters, and then rabbit, and then I had a veterinarian.
So that
who was
is
like
something that happens, and so that's been described in the literature that if you develop allergy to one, you're then more likely to develop allergy to another, unfortunately. Even though when you first test them, they're very specific to one. Just the mouse urinary allergen, and that's it. But then this person is at increased risk of developing a secondary one. I think it's worth trying to switch them and see, but it's definitely described. So one question is, who should be screening animal workers, and how should you be doing it? One of the things that, prevention, pre-placement screening, when people come and say they want to work with animals, is there something to really do? And obviously they want a job, they want a degree, they want a career, so that they don't always answer truthfully on a questionnaire about have you had any allergies, have you had any problems. They want the job, and they may say no. So is there a role for skin testing of animal workers at baseline? And OSHA has put out a recommendation for that, but it's not required. And it's not a standard of practice that I'm aware of. Is anybody aware of doing baseline skin testing for any groups of animal workers in Seattle or the animal labs? And the other question is, should you do some kind of, if people are working in a workplace with a lot of dust, there's an OSHA standard that they need to get baseline spirometry and be monitored periodically for their breathing function. But in an animal workplace, there's no such OSHA requirement, so there's no absolute requirement at baseline to assess their respiratory function and have a baseline to compare that to later on. But I think it's an open question that with these large amount of animal research going on, should there be a more organized program to do a little more than just a screening questionnaire at the beginning to decide what to do? And then once they start work, what sort of surveillance should these people have? Should they have periodic skin tests? Should allergists or anybody else be involved in trying to see who's developing a problem? Again, we rely on a sort of confidential questionnaire that is administered usually over the internet. This is the University of Washington, at least, where someone then answers if they're having any problems. Again, if you're a graduate student and you want to do well and you don't want to make waves, you're likely to underreport some of your symptoms, and makes the screening questionnaires of questionable sensitivity. So should there be some more rigorous types of surveillance? Should we be doing skin testing or anything else periodically on these people? We certainly do this for other types of occupational exposures where we look pretty carefully for some early signs of disease, and we don't really do it with animal allergy. So what are the things you should do in a laboratory animal case? And this is for you to critique if you have any other thoughts about how to do this, but I think it is important to try to confirm the diagnosis of what is the agent. Can you get an IgE response, or either through blood testing or skin testing, and try to narrow it down to particular allergens that are going on, and not just assume what allergen it might be. Remembering that, again, some of the problems could be something besides an allergen. It could be endotoxin. Obviously appropriate medications. Evaluate the lung function. I was wondering, you talked about a bronchoprovocation challenge, which I've up until recently been back east at Yale, where we had some research going on for bronchoprovocation tests, but we didn't really do it in an outpatient setting. So is anybody else doing it in Seattle? It was really unavailable in our area, except in Montreal. It was not a lot going on in the Northeast. Are many people doing this here?
No, it's Len. I mean, really. Len gets all those patients. The rest of us do.
Yeah, because it's a certain
Do you do them at
little bit of risk.
It started
to take
with
on
crab.
to it.
There were 3 places that I knew of in the world basically doing it with crab, and it's where crab is a big commercial crop. It was in New Orleans, there's a fellow in Montreal, and we were doing it here. And because of Alaska, those are the 3 places, the Gulf of Mexico, where it was an industrial problem.
And do you do other things besides crab and fish? Do you do other?
No, those are the only. And the only reason we do fish is that it became an occupational problem here, and the fish companies were seeing about 5 to 10% of people who they were sending out to work on the fish processing boats up in Alaska were getting sick, and they didn't know how to handle these people, and somehow they found us and would refer them to us. And my major concern is that when I asked you about if, basically these people, they make a tremendous amount of money in this industry.
Yeah, in a short amount of time.
In a short amount of time, very hard work, but they didn't want to lose their job. But I was concerned if we kept sending them out there, that they're going to develop chronic lung disease, and it was ultimately going to become an L&I and an economic problem
I
for
would
the
agree with
industry.
you. I would be concerned about that, yeah. How about peak flow diaries? Do people have, do you have patients keep a peak flow diary when they're concerned about something in the workplace? Is that something that happens very much? It's one of those things where the history is not always clear about that, and there's obviously, not everybody keeps a good diary, but that is something that sometimes is recommended and sometimes helps. I'll show you a picture of one. The exposure reduction is a great idea, and really a lot of labs, it's in their interest to know that there's a problem and do something about it. And then I think to figure, as you said, about switching to a different species or a different type of job. The problem is that even at low levels, if they're really sensitized, they may still be reacting, and then you can get a secondary allergy because it seems like they're more prone to get something else. This is just example of a peak flow diary. I've done a lot of these with patients, and I find that it's sometimes useful, but you need a compliant patient. If you get one of those really very obsessive patients who loves to record things, definitely gives them something to do. And you can just see if there's a big variation in their peak flows between when they go to work and then when they have a weekend off or a couple days away from work, and see if their peak flows improve. Remembering that some allergy, some asthma reactions, and you probably see this in your provocation challenges, sometimes it's immediate, but sometimes it's delayed. So that there are certain types of, especially low molecular weight allergens, will have a delayed response where you actually get exposed in the morning, and then your peak flows drop in the evening. So that can make the peak flow more difficult to understand. So I'm going to talk about one more case, which is a farmer with a cough. And so this is a guy who was in the city, but he really wanted to do something kind of Northwest Cascadia, sustainable, organic, and he wanted to go work on an organic dairy farm, and he's developed a chronic cough. And so he's referred by his primary care provider to you for possible animal allergy. So what is somebody working on a dairy farm going to be exposed to? And he's not a person who's had a lot of allergy or asthma problems before. He's a non-smoker. He's spending a lot of time milking cows, and some of the farms around here milk quite a bit, sometimes 24 hours a day. And he notices that even though you haven't done a peak flow with him, his cough gets better when he's away from work, which is always an important occupational history. So what's up on a farm, and what's this all about? The farm effect, and how does this relate to allergy? So there's obviously animals on the farm, and there are direct allergens related to those things like bovine allergens. There's also a lot of mites, dust and grain mites, and other types of small insects. There's plant allergens, and then things like mold and thermophilic actinomycetes, which is a bacteria, but it's spore forming, and it causes it's the cause of farmer's lung, and it grows on moldy hay. So there's a lot of things that you could get into your airways that could do things to you. And what's interesting is that when they actually look at people who've been working in dairy for a while, around all these cows, around all this dust, around all these other things, that the rates of animal allergy, like allergy to the bovines, is actually very low among dairy workers. So it's not clear that people are really getting allergic to things like cows themselves. And if you think back about endotoxin in laboratory animal situations, there's a lot of endotoxin on a farm. There's a lot of manure, there's a lot of gram-negative organisms that dry up and go into the air. And so it really seems that endotoxin exposure to the airways is an important thing, and it causes, again, an inflammatory reaction. And what's interesting is that when they do sort of epidemiologic studies and they figure out how much endotoxin someone was exposed to in a particular farming type of job, they find that the people in the higher endotoxin types of jobs have less allergy in general. So like lower IgE levels, less allergic symptoms, less problems with asthma when they're exposed to a lot of endotoxin. At the same time, endotoxin is not the greatest thing for your lungs. It can cause this thing called organic toxic dust syndrome, as well as sort of chronic bronchitis from this chronic inflammatory response. So it's a little bit of a trade-off, is that there's something good from an allergic point of view about having your airways stimulated by this little inflammatory response, but too much of this inflammation is not so good for you. And organic toxic dust syndrome is something that you see in people who really go into an area and they just get a whole blast of really organic dust. And again, it's this big mixture of all the dried up things you would get on a farm. And we see that in people working around chicken farms and dairy farms. You see it in mushroom workers, bird breeders, and it can be an acute flu-like syndrome and cause a pneumonitis and a little interstitial infiltrate. You can get a cough and fever and malaise with it. Again, looks a lot like the flu, and it's thought to be a toxic mechanism with high levels of endotoxin and other things as well, and it's not autoimmune mediated. So it can look a lot like autoimmune things, but it's things thought to be more toxic. And how does how does all this relate to this other idea of the hygiene hypothesis, and that you've probably had patients talk about, and you've talked about the fact that maybe being around animals and plants and out in the country is really good for you, and that every kid should get a chance to get nice and exposed to things on a farm, and it's the healthy way to be.
It should be part of fellowship.
So how much hygiene is good and how much hygiene is not good? The literature is continuing to debate this, but it's certainly observed more in very young kids. Even neonatal exposures, they think, may have a role in somehow priming the immune system to be less likely to develop allergy and asthma. So the literature, as I read it, is somewhat stronger in Europe than the United States. But I think a number of studies have repeatedly shown lower rates of allergy and asthma among children growing up in an environment where there's a lot of animals and other allergens around. So what about a person who grows up in the city and then moves to a farm at an older age? Can their immune system have any beneficial effects by being exposed to all that, or are they just going to get sick and allergy and all that kind of thing? I think that's something that's not as well known. And one of the links I think that we're going to see developing in this talk about the hygiene hypothesis, we definitely feel that it's partly exposure not just to allergens at an early age, but really to microbes. And a lot of the different microbiome of a farm has a whole colonies of organisms that you don't necessarily get in the city, and that we think that the microbiome of an infant is sort of set at an early age, and that can have a lot of impact on our immune system development and what we tend to recognize as self or not self eventually. So that I think that all these microbial exposures we're going to learn more about what is considered sort of a healthy gut microbiome and which is a less healthy gut microbiome, both for allergy as well as metabolic things later on. And I think we'll start understanding more about, does the microbial input from being around a lot of animals and farms, and as you know, in terms of homes, I believe there's certainly a literature showing that if you grow up in a house with pets, you have a less risk of allergy than if you grow up in a house without pets. There's certainly a number of studies that have shown that, even though when you have a kid with allergy or asthma and there's a pet in the house, it's probably still a good thing to consider not having that pet anymore. But across the board, people growing up in houses with pets tend to have less allergy. So how does that? I think we'll understand again more as the microbiome may be somewhat of a central process in understanding how our exposures turn into our allergies at some point, and that's sort of exciting developing field to keep an eye on. And I just want to mention one or two more things, which is as you think about allergy and somebody who's got some complaints working around animals, think about hypersensitive pneumonitis. And is this something that allergists tend to diagnose, or do you send this to the pulmonologist, or how often does an allergist make a diagnosis of HP? Is this in your experience? Do you work people up for HP?
Yes, but it's infrequent. Very infrequent,
yeah.
but we work them up.
Do you tend to do it with a pulmonologist, or do you?
If they need a lung biopsy, yeah.
Otherwise, you just
We don't do lung biopsies, so.
Yeah. And is there a a center in town for interstitial lung disease where they may send you to get this evaluated?
I think so. The University of Washington has Ganesh Raghu has a lot of expertise in this area, but I don't think we usually send them to him just because most of the time it's obvious.
Okay. And does he ever send patients to an allergist or something to work it up for exposures or trying to figure out what to do? Because these can be difficult cases of, is there still something going on? The big ones, the most common ones of the animal workers, farmer's lung, related to these thermophilic actinomyces, these mold-forming bacteria on hay, bird fanciers lung, mostly parrots, parakeets type birds, the most common, and we think it's related to some type of feather antigen, some of the bird antigens. Pigeon breeders lung. Those are just some of the big species, and as you know, it's not an IgE mediated process really. So when you do serologies, you're looking for IgG antibodies, not IgE antibodies. And it's granulomatous interstitial lung disease with scarring, and it's definitely one of those things that we saw a patient who had been working in a veterinary office where they had a lot of parrots and was continually coming down with little flu-like symptoms and just was treated for pneumonia over and over again by primary care docs, and now is up for a lung transplant because of really severe restrictive lung disease that's progressive. So it's pretty nasty if you don't pick it up early and do something about it. Are you guys doing serologies for HB, or is that pretty helpful?
Yeah, they're not very helpful, I don't think, most of the time. I'll tell you what I see the most is people that get a biopsy and they have interstitial lung disease, and the biopsies are not conclusive. As you know, it's not absolutely diagnostic. When they have it, and they say, does this person have HSP? And then we see them, and they don't have any overt exposure to organic dust that would do this. And so they have an interstitial lung disease of unknown cause. But on the other hand, a lot of them are labeled as HSP without any clear exposure.
Without a clear agent, and that's really tough.
Yeah, because there's nothing diagnostic, and people do those antibodies, and again, I don't think they're usually much help. So. Yeah,
they could be just, they indicate exposure more than disease, as you know, and a lot of people are exposed to some of those things. But so consider that bronchoalveolar lavage tends to show lymphocyte predominance. One thing we found, in these kind of questionable cases is, and there's a lot of questions. I was back again in the Northeast where everybody's worried about mold, and there were times where we would just, if they were concerned about something in the house. And by the way, I'm not too aware of the average dog or cat pet causing hypersensitive pneumonitis. It's more if you have a parrot in the house or something like that. But if they're concerned about mold in the house or a particular environment, we would just take them out for 2 or 3 months and see if they improved at all, because these are people with often really troublesome interstitial disease and interstitial lung disease who are facing prolonged courses of steroids or immunosuppressives or even lung transplant, and so you want to do everything you can to see if you can make them a little bit better, and we just sometimes try to remove them from whatever environment they're in and see if that makes them any better. So the last thing is just this idea of when you're dealing with animal health issues in terms of animal allergies, there is this movement or really an attempt to kind of bridge communication between the human health people dealing with these issues from the human side, and then on the animal side, you've got all these people taking care of these, just take Seattle, you've got all these professionals now taking care of these pets, and anybody who's gone to the veterinarian knows how sophisticated and expensive it is to take your pet anywhere, get it treated. But all over Seattle, there are MRIs for pets, there are CAT scans, there are chemotherapy, they're doing radiation therapy, so they have linear accelerators to do radiation therapy. It's this whole parallel universe of medical care, and I think animal allergy kind of brings it together where you may be telling them to get rid of their pet, and they may be giving slightly different advice. And so, has anybody communicated with a veterinarian about an animal allergy issue and found that helpful? Or can you give an example?
Yeah. Me and Drew, we were called over to the Seattle Zoo and to do testing on a gorilla. So we worked with a veterinary dermatologist who had her own set of panel, and we did our own panels. And one of the interesting things that she had was human epithelium.
Yeah, so animals get allergic to people, and that is something that happens. Cats get allergic to people. Yeah.
Along with lots of other stuff we would never test for, like alfalfa and like all sorts of interesting stuff that would be in beddings and things like that.
And what was the outcome of the case? Did you find out what the gorilla was allergic to?
Well, in ours, what was it? Dust mite, and there was a tree. It was like
I forget which tree it was.
I forget it was a tree, yeah. But there was...
And is this the same gorilla that had sinus surgery as well? Yeah. So this is a famous gorilla. Yeah. So so just realize that the veterinarians are going to be dealing with the animal allergy. They'll be finding out what the animals in the house are sometimes allergic to, which can sometimes include the humans. So they're dealing with some similar things. And the question is, can veterinarians and physicians work together to do something to better assess the environment and figure out how to keep it healthy in some way, whether it's at the zoo and dealing with dust mites or anywhere else. But I think that you'll find that the veterinarians are becoming more and more sophisticated medically, and the types of interventions are more and more, including things that they are putting on the animals, all the flea treatments and things like that, which could be some exposure to your patients as well. And I think that when it comes to what Len said about people not wanting to get rid of their pets, sometimes the veterinarians have some suggestions about ways to reduce, to change the way the pet is being taken care of, to reduce some of the other exposures to bedding and potential food and other things, and the way the hair in the house is dealt with that could sometimes be healthy. People are trying to sell hypoallergenic animals, make a big business out of hypoallergenic animals. I'm not still impressed by how non-allergenic some of these things are, because it's not, they say, well, the dog doesn't shed at all. Well, oftentimes the animal allergy in a house is not related to the hair as much as the skin flaking and other types of animal dander. So is anybody else impressed with hypoallergenic animal breeds, like dogs that are hypoallergenic?
Every patient has one.
Every
patient has one.
And it's only theirs. It's not anybody else's.
And we agree with you. There is
Yeah,
many
I don't
things.
think I think it's a lot of money going toward not incredible stuff. So remember, communication can be important, and in general, think about making the right diagnosis and what you can, the things you can do about it, and sometimes really requires a interdisciplinary cooperation to handle it. So I'm going to be doing some work at Harborview with in occupational medicine there. If there are any interesting workplace issues, we'd be interested in seeing some people who are dealing with employers or having any problems in the workplace related to animals. Yeah.
Just a historical note. Giuseppe Gramazzini in 1700 as a medical student was the first doctor to ever ask a patient, what kind of work do you do?
Yeah.
And he discovered stonecutter's asthma, printer's asthma, and baker's asthma. So he's the father of occupational medicine.
He absolutely
Italia.
is. He absolutely is. And I don't think he talked a lot about animals in his book, but he certainly described a lot of other things. Yeah. And it's a fascinating book. If anybody go back a couple hundred years and read it, it's still available. It's called De Moribus Laborum or something like that. The Diseases of Workers.
Very good. Any other questions or concerns? Just to show you how extreme, I saw a woman yesterday who we've had on conventional allergy shots for 5 years. She's highly grass pollen allergic,